In this video, I'll be comparing Blue Shield of California and Health Net on Covered California. I'm going to be breaking it down in plain English, no confusing insurance jargon, so by the end of the video, you will know the key differences between these two carriers and which one might be the better fit for you. I'm Sebastian. Every day I talk with people about their health insurance, and I've had countless of conversations with individuals and families who feel overwhelmed by all of their choices. I mean, my job is just to make this simple for you so you can make a confident decision. First off, quick context. Covered California is our state's health insurance marketplace. It's where you can shop for health insurance plans, compare the plans, and often get financial help to lower your monthly costs. Now, before we dive into Blue Shield versus HealthNet, there is something important for you to know about Covered California. The plan levels, bronze, silver, gold, and platinum, are standardized. And that means if you're comparing a silver 70 plan, the benefits are identical no matter which carrier you choose, right? The deductibles, the copays, and the out-of-pocket costs will all be the same. So the real difference between HealthNet and Blue Shield isn't the benefits, it's the network and the cost. The reason why these two carriers get compared so often is because they're the only two options on Covered California that offer PPO plans. So why does that matter? Well, PPOs give you much more freedom compared to an HMO. I mean, with a PPO, you don't need referrals to see a specialist. You usually have a much larger pool of doctors and hospitals to choose from, and you even get coverage for out-of-network care in some cases, though usually at a much higher cost. With an HMO, you're locked into a smaller network, and you'll need to go through your primary doctor to get a referral before seeing a specialist, right? And that flexibility is exactly why many people compare HealthNet and Blue Shield, right? They want a PPO, and these are the only two carriers still make it available on Covered California. So let's start with HealthNet. HealthNet is generally the lower cost PPO option, right? If you want that flexibility of a PPO, but also need to keep your monthly premiums lower, HealthNet is usually going to come in cheaper than Blue Shield. Now, what's the trade-off? It's the network size, right? HealthNet's PPO network is usually smaller compared to Blue Shield, and that means fewer doctors and hospitals accept HealthNet PPO in many areas. But this isn't the case everywhere. I mean, in some counties like San Diego, Riverside, and parts of Orange County, HealthNet's network is actually quite competitive, and the pricing can be notably lower than Blue Shield. So if you live in one of those regions, HealthNet could give you that PPO flexibility that you're looking for at a much more affordable price. By the way, if you're not sure which Covered California plan is the right plan for you, I'd be happy to personally assist you. Just click the first link in the description and book your free call. Now let's switch over to Blue Shield of California. Now Blue Shield's PPO option is more expensive, but with that extra cost, you're getting access to a much stronger network. When, for example, in Los Angeles County and San Francisco, Blue Shield tends to dominate. I mean, they contract with many of the sought-after doctors and hospitals in California. I mean, we're talking about places like UCLA and UCSF. Some of these hospitals and doctors won't even accept HealthNet PPO at all, and they would require Blue Shield. So if you have a specific doctor or high-profile medical group in mind, there's a decent chance that you need Blue Shield to see them. And the bottom line is Blue Shield's PPO usually costs more, but you're paying for access to the widest network and some of the top hospitals in the state. So the choice really comes down to this. If your priority is keeping costs lower and you live in an area where HealthNet has a strong network, they might be the better fit. If your priority is access, especially to major hospitals or hard-to-reach doctors, Blue Shield may be worth the higher premium. I mean, both carriers can work very well depending on your situation, but your zip code and your doctors are really what determine the best choice. And again, if you're not sure which plan makes the most sense for you, I would be happy to personally assist you. Just click that first link in the description and book your free call.